Good morning. Thank you all for calling in on the February edition of Ask Me Anything. We've got a lot of exciting news here at the State Treasurer's Office, a lot going on, as you all know. So without further ado, we'll turn over to opening remarks to Treasurer Folwell. Treasurer?
Thank you all for joining us today. We have had, since our last Ask Me Anything, we've had lots of committee meetings or boards that I chair, and the latest one was the debt affordability study, where we outlined to the General Assembly and the governor what the debt affordability of North Carolina was going forward. This is something that is required statutorily by the state treasurer every year, due by February 1st. And with that, Frank, we'll just go ahead and take some questions.
Great. Thank you, Treasurer. Dave, we'll go ahead and start with you.
Treasurer, your press release said you'll provide an update on the plans to reduce healthcare costs and create transparency. Could you share that?
Yeah, we have just finalized our contract on what we call reference-based pricing. What's interesting, as some of you may know, we're talking about bringing transparency and lowering costs for state employees and retirees, so that the state health plan can live within its budget, given the fact that that we have one of the largest unfunded liabilities in the United States. So, Dave, operationally, got the contract where we're sending it out to providers, and we're working on getting some folks signed up. Secondly, the amount of information that's coming into us, actually by people who work in the healthcare field, who are explaining to us where the problems are simply amazing. Not just from teachers and troopers and other people on the plan. These are people who actually work in healthcare who know that something is wrong. I want to say something on this call that I've never said before, given the fact that there's hundreds of thousands of dollars being spent on radio and television ads regarding this issue. As we sit here this morning, by agreement, people who are injured from a workers' compensation injury are provided health care in this state by medical providers at Medicare plus a 40% profit. 40. Prisoners who are in need of medical attention in this state are provided health care across North Carolina for Medicare plus 40% profit. The plan that we have put forward, which increases transparency and lowers cost, is offering medical providers across North Carolina, on average, a 77% profit. So my point of saying that to you is that these are all healthcare services that are being offered to people who unfortunately have been injured on the job, to prisoners who are in need of medical attention, but also to, that's why we feel so strongly about this. We have some medical providers that are charging the state health plan 600% and 700% of Medicare reimbursement rates. And it's interesting with the announcement that came out yesterday about the Medicaid contracts, that the very hospitals who say that they can't do this service at a profit on average of 77% across the board, we're aggressively bidding on the Medicaid contract. Medicaid contracts are dramatically below Medicare reimbursement rates. So that's an update, but I'll be glad to take a follow-up, Dave, if you have one.
Just quickly, if you all could put your phones on mute if you're not asking a question. Dan, do you got a follow-up on that?
Dave.
I'm sorry, David. Sorry, Dave.
Well, explain further what you meant by the Medicaid. You had 5 bidders, including Blue Cross and United Health, want to get into that program, which I think is 1.7 million people in the state, 1.7 million?
Yes.
And what does that tell you? Yeah.
Well, what that tells me is that they wanted the business, but what I was trying to say is there was a consortium of 10 or 11 hospitals that were organized through another entity, I believe, out of New Mexico. And the hospitals themselves were trying to get into the business of providing these services at a reimbursement rate much lower than what we're offering.
Yeah.
And David, David, I don't know what the exact rates are, but let's say a 10-year-old who has has appendicitis, the Medicaid reimbursement rates, Dave, across the state are probably somewhere between 68 and 74% of Medicare.
Okay.
Okay. We're offering 140, 150, on average 177% of Medicare rates for the same kid who has an has an appendicitis, but is under the state health plan.
Right. Okay.
Yeah. But yet they say that, you know, they offer all these rates and they do all this business and they're going out bidding for this business at rates much lower, but they don't want to provide service to the people who teach our kids, protect us from criminals, and pave our roads and all the other core functions of state government.
Yeah. You also mentioned healthcare professionals are contacting you. Are you putting that on the record at all, or how are you dealing with that information?
We're just, it's coming to us from all kinds of sources. I've mentioned in the previous call, Dave, that we had a teacher who, before Thanksgiving, was referred in to get a endoscopy and was told they need $1,200 up front, and they would not be able, no one could tell them what the total charges would be. That's just what they needed to get the procedure done, $1,200.
Yeah.
And then this person took all that negative energy and over the next 6 days realized they can get the same procedure for 29 miles from their house at $215 cash without even submitting an insurance card. Total, period. But since then, and as I go across the state, we have doctors who want to practice medicine. We have medical professionals who just want to practice medicine, physical therapists and the like. And they know that with the way things are going in North Carolina, that the consolidation of healthcare in North Carolina, their ability to stay independent is shrinking by the day. And what our plan does is it affirms and gives a higher payout on average to primary care doctors so that they can financially remain independent, to behavioral mental health specialists so that they can remain independent, and then helping obviously the rural parts of North Carolina on top of that.
Dave, you got anything else?
Thank you.
Great, thanks, Dave. Let's see, I'm looking at the list. Dan Way, are you on the call?
Yep.
Go ahead, Dan.
Yeah, I was just wondering with the debt affordability study that just came out, you know, there's a lot of focus on that, but the transportation portion of that, as I understand it, they're going to reach their debt capacity before the end of the 10 years. I was wondering if you could elaborate some on that.
On the transportation side?
Yeah.
Yes, and actually we have a consultant's report that was given to us by the Department of Transportation, by their consultant. I met with the DOT folks and their consultant who affirms what you just said, Dan. What I would say to you is that whether it's weather related or economically related, that the fits and starts of actually building roads or redoing roads and bridges is not as clean as just putting on a spreadsheet and saying this is when we're going to issue the bonds, this is when the money becomes available, and therefore we're going to run out of money. If you look at that schedule, you're exactly right. They have promised $3 billion worth of bonds, but the debt affordability recommendation, which was approved, does not let them get to that $3 billion. We have a high comfort level based on where we think interest rates may be going over the next few years, and you can just imagine what just a slight change in interest rates can do to those numbers 10 years out when you talk about that amount of money. That we think with that and the timing of when you actually issue the bonds, when contracts, construction projects are actually ready to be paid for, that the combination of all those things will put them very close to the $3 billion after the end of 10 years.
So are there any proactive things that might take place, delaying some of the issuance or scaling back on some of those projects, or how would all that be decided?
It'll all be decided probably 2 or 3 years from now as you start getting about halfway through this cycle. And I don't say this as a voice of experience. I've only been the treasurer for 24 months. And I'm saying this based talking to people who have been to this rodeo over the last few decades, who have the responsibility for this. And this always happens. It doesn't matter who the treasurer is, doesn't matter who the president is. It's just that the cleanliness of a spreadsheet to say this is your debt affordability. There's always a little bit of adjustment that goes on there based on when the bonds are issued, what interest rates are, and what's happening as far as construction projects.
Does it give you any cause for concern at all?
My pause for concern is in this consultant's report, which was commissioned and paid for by the Department of Transportation. They confirm what I've been saying all along, that these bonds that we're going to issue are not going to be AAA rated. Now, there could be an argument there that North Carolina's credit quality is so strong that it doesn't matter if they're AA plus or AAA rated. The interest rate that we will pay will be about the same. But the fact is, as the keeper of the public purse and the state treasurer, I like for any debt that the state issues to be AAA, AAA, AAA. But the fact that this was not approved by a vote of the people is one of the leading indicators of why it's not going to be AAA. Secondly, which I said back last year, is that when you go to the voters and ask them to approve debt that they're going to be asked to pay, when you do that in a transportation bond, you have the responsibility of telling them which projects you're actually going to spend the money on. We, no pun intended, we don't have any of that in concrete. We've seen at least 2 different spreadsheets that have different projects on it, and then we look at another spreadsheet and it doesn't have that project on it at all. And so I'm very concerned when we're putting this much debt on the people of North Carolina, and the project list keeps getting adjusted back and forth, and that's the flexibility that you have when you don't go to the voters and ask them for their vote.
All right.
Dan, you have anything else? And obviously we'll come back to anybody else who may have asked a question if you have any additional follow-up. But do you have anything else for us right now?
I'm just wondering what DOT is saying in response. You heard from them at all?
Well, I think we heard from the DOT in the form of the proposal that came over from the Secretary of Transportation and the Chief Financial Officer of the DOT, who asked us to increase the percentage of transportation revenues that we would multiply this number by in order to raise the debt ceiling. This is different than the proposal that Budget Director Peruce was offering about raising the ceiling. That was on the debt other than transportation debt. This was another proposal where right now we use a 6% of revenues ceiling on how much debt we can issue. Their proposal was, they said that was too conservative and that we need to raise that to 15%. And that's not what the Debt Affordability Commission ultimately approved. They approved that we not mess around with any of the formulas that we've had since I've been putting forward debt affordabilities, and that this debt affordability study includes the massive unfunded pension and health care liabilities of North Carolina. These things are debt. The rating agencies do consider them to be debt because the people who are depending on these retirement checks and depending on the state for health care, they're expecting those checks to go out and those bills to be paid. I don't know any other definition of debt that you can have than that. So I would ask the DOT about their proposal about the AA plus bond rating. You can ask them about the project list. Where is the project list and what does it have on it? And you can also ask them about their proposal to more than double the formula for determining debt affordability for the transportation department. Now,
Thank you.
I will say, even though you didn't ask the question, when you start looking at some of their analysis, they start using medians and modes, and those are all questions I failed on the CPA exam. So we're not going to get into a test about medians, modes, and means today. And I guess all the journalists, see, Dave just laughed. All the journalists are very happy we're not doing that. But I will tell you one of the analysis that was presented to me, it talked about where we are in relation to peer states and border states. But ironically, when they were trying to convince us to raise this from a 6 to a 15% of revenues for the transportation bonds, they included Maryland in, which is a very high tax state, and they left Tennessee out, which is our border state, which is a very low tax state. When you take Maryland out and put Tennessee back in, which is the formula that's been used before I got here, you see that we're being very conservative, and that's what I intend to do as long as I'm the treasurer.
Thank you.
Thanks, Dan. Mark Tozak, are you on the call? Mark, did you make it?
Yeah, I'm on the call. I don't have any questions. I'm good. Thanks.
Okay, thanks.
Thanks, Mark.
I've got a lot of maybes on my list. Is anybody on the call that has not asked a question?
Yeah, hi there. This is Will Dorn from the News and Observer. Can I get in?
Absolutely, Will. Welcome.
Great, thank you. I wanted to get back to the state health plan for a second.
Yeah.
I know I've heard, before that, the changes you're proposing, if they went through, would save the state hundreds of millions of dollars a year. I assume that's still your reading on that. I assume that's why the hospitals are opposed to it. Is there anything, that y'all are talking with the hospitals about, ways that they could make up some of that lost revenue? I don't know if that includes Medicaid expansion or any other changes in, billing, funding, anything like that.
Great question. Let me mention two things. Number one is that this is a reset that is expected to produce $300 million worth of savings to the state health plan and approximately $66 million worth of savings to the state employees and retirees through out-of-pockets and co-pays and deductibles. What you may not know is that in the annual report of UNC Healthcare of last year, they initiated a cost-saving approach where just that one entity, they brag in their annual report, that one entity, which we do about 10% of our business with, that one entity cut $300 million out of their cost structure. I'm trying to cut $300 million out of 10 times that amount of money. So, number one, I wanted to direct you to that report. Secondly, as far as the hospitals are concerned, it's very hard to have a conversation with folks who, number one, say on the record that North Carolina is not a governmental purchaser of health care. That number two, that we have to continue to cross-subsidize. The state health plan's responsibility is to cross-subsidize their other books of lines of business within the healthcare. This has been more transparent over the last few days when either the head of the association or actually the president of the association said that there's always been this unwritten compact, C-O-M-P-A-C-T, that state health plan and maybe people like us are supposed to cross-subsidize other folks who are in need of health care in this state. We never signed a compact. The compact has never been through the legislature. It's never been discussed. It's not written down anywhere. So this agreement that everybody refers to, this compact, that our state employees and retirees are supposed to pay for subsidize the health care of other individuals, doesn't exist. But the third thing, which I've said before, which is more nauseating, is that if we're successful in doing reference-based pricing, which brings transparency to the customer, let's remember who the customer is, that brings transparency to the customer, drives down cost, and pushes the power out to them. If we're successful in doing that, they're just going to order more tests on these individuals so that they can drive up revenues. So it's really hard to negotiate with anyone who starts with those three basic tenets of their argument. We're not a governmental payer. We have to agree to this compact that's been going on for decades, and we can't break a compact that we never agreed to. And thirdly, they're just going to drive up testing on our employees if we're successful.
Will,
Thanks.
you got more follow-up?
No, thank you. That was it.
Go back to the annual report of the UNC Healthcare.
Well, I'll have it sent over to you, Will.
One entity cut $300 million out of their cost structure. We're trying to cut $300 million out of the whole state health plan, which is anyway.
Frank, this is Jeff with the County Compass. I'd love to get that that data on the UNC health plan.
We'll get it to you, Jeff.
Thank you, sir.
Yes, sir. Does anybody else have any additional questions?
Hi, this is Ginger with the Daily Reflector. Where do things stand right now, sir? Is with your the word just escaped me. With the state health plan, is there going to be legislation introduced? Where does everything stand with your proposal?
Well, our proposal has been approved by resolution by our Board of Trustees. We are proceeding. We have a lot of activity going on of people who are excited about what we're doing. We are the only legislation that you may be referring to, and thank you for calling in, Ginger, is that there's been proposed legislation to stop the Treasurer's Office from any kind of reform of the state health plan for basically either the end of my term or as long as I'm the treasurer. But nobody's ever seen that piece of legislation. Any piece of legislation that would be filed would be to decrease transparency, increase cost on state employees, and have more control and not push the power down to the consumer. And I would say you're from Greenville, Ginger?
That's right.
It's a big issue all across the state. It's a big issue not only because of where Greenville sits relative to east of 95, but it's a big issue because of the high concentration of state employees that you have in Greenville. All that's very, very unique. And there's no one that has more statutory or constitutional responsibility or interest in the success of accessibility or affordability of healthcare in eastern North Carolina than the Treasurer of North Carolina, no matter who that treasurer is. Because the Treasurer of North Carolina is the chair of the Local Government Commission. And all of these entities across North Carolina have to come in front of the Local Government Commission in order to issue debt. And having affordable clean water and sewer, having good schools, and having accessibility and affordability of health care, all those things go into the major thing that is important at the end of the day to people in eastern North Carolina. And that is for these communities to have access to money, to be able to borrow money for their needs. And that's something that's very high on my list every single day.
Well, and I'm sorry, I might have missed the point there. What does the access to debt, how does that play into wanting to reform the state health plan?
Because because all this stuff is connected.
Mm-hmm.
And, sorry? Yeah. Well, when you talk about rural North Carolina, you're talking about having access to health care, having access to water and sewer, having access to good schools, and all of those things are things that are looked at when these communities go to borrow money, or even these hospitals go to borrow money. You know, the very hospitals that you may be referring to actually come through the Local Government Commission and the North Carolina Medicare Commission that I just mentioned to you. So all of this is connected. You can't, yeah, go ahead.
Did that clear it up for you, Ginger?
Actually, I want to go back and talk a little bit more about when will we start seeing the change in the state health plan, and how will state employees and the public in general sort of start seeing the shift?
Well, number one, we're in our contract period right now, which will go for another 5 months, but the implementation is scheduled to be a January 1 of 2020. Number two, since you mentioned state employees, the State Employees Association, which is the voice of state employees across North Carolina, has wholeheartedly endorsed this, and they stand behind it completely. And I would suggest that if you want to know why they are so strongly behind this, that they'd be very much willing to talk to you.
Yeah. Okay.
Could I follow up on that question, Dale?
Yeah.
Do you know what percentage of the hospital system in Ginger's hometown is state health plan revenue?
We have asked that question, and we've also asked for Vidant, for example, to give us permission to release to about how much healthcare costs have gone up on their customers in Eastern North Carolina, and they said they do not consent to us doing that.
Thank you.
I mean, and I don't question what they say. I'm just saying that if people are really interested in accessible, affordable health care in Eastern North Carolina or Western North Carolina or the Central Piedmont of North Carolina, then if that's really where their heart is, then they should be willing to show people how much they've gone up on the cost of this over the last 5 and 10 years.
There have been organized visits to city councils and community groups in the eastern part of the state. Have those people contacted you?
No.
Have they come to Raleigh to talk about this?
No.
The community leaders and such, they haven't?
No.
Okay.
As a matter of fact, I was looking forward to debating the head of Vidant, who's also the head of the North Carolina Hospital Association, or the executive director on Spectrum TV on Tim Boyum, Loretta Benitez show, and I was looking forward to that. They're the ones that called and suggested we do this, and then when we went to schedule it, our approach is anytime, any place, anywhere. They said that the only way that they would appear on that show is if they were on a segment separate from me. So this issue of having, did I misspeak?
Yes, sir. They said that they would only use Mr. Aiken out of Cone Health, but
right. But they themselves were unwilling to do it.
It was
make them
my understanding that they were
unavailable to do this. So that's a little bit of a nuance. But the fact is that when you're dealing with something this serious, that is this out of control, when you're trying to bring transparency and light, lower cost, and push the power down to the customer, everybody forgets who the customer is here. When you're trying to do that, getting little bits of information from all these sources it's really hard for people to process this. That's why having two people on camera at the same time, so when somebody says something that's not true, you can combat it with the facts. That's what people want. People are not, they don't wake up in the morning thinking about all these issues. They just want to be able to get the information so they can be informed about what's going on. And I think what people across this state realize is that, they don't know what they're consuming with health care. It just consumes them. They get bills in the mail they don't understand. And we're better than that. We have enough needs, enough providers, enough billions of dollars we're spending on this issue. We ought to be able to figure this out. And in the process, we ought to be able to figure it out so that we can lower the family premium so that the average teacher, the average trooper, the average state employee can actually afford to insure their family and not have to work 1 week out of the work month, not for food, not for fuel, not for housing, but just for this issue. Go back to Ginger, see if she had anything else.
Ginger, you got any follow-ups?
No, I not at this time.
Okay, thank you. Does anyone else have a question for the treasurer?
Yeah, this is Travis from WRL. I've got one.
Go ahead, Travis.
All right. So the House and Senate have some competing plans for education funding. The House wants to do bonds. The Senate wants to do some version of pay-go. The House version would have to go before voters to raise these bonds for schools construction. Does the Treasurer's Office have the same authority to hold off on issuing bonds when they're approved by the voters? That is, if the voters approved an education construction bond, would it still be up to the Treasurer's Office to decide exactly when those bonds are let and possibly hold some releases in abeyance and delay that money?
Travis, I don't have the subject matter experts from the local government commission sitting here, but I'll say what I've said to you in the past on other subjects. I don't need a law to tell me what's right and what's wrong. If the voters approve a bond or the General Assembly tells me to issue debt, I'm going to do it as expeditiously as possible as soon as we're asked to do so.
Okay. Okay.
Additional follow-up?
All right, I appreciate it.
Travis, you got anything else?
I mean, I'd love to see what the actual authority is in the law, but I'm not in an all-fire hurry on that today or anything.
Yeah. All right. Well, number one, we'll follow. That's a great question. We'll follow up on that. I will tell you that. I'm sorry, I got so many billions running around in my head today. When I was sworn in as treasurer, no bonds have been issued on Connect NC. I think that's correct. And after about 8 months, we issued $200 million worth of bonds because that's how long it took the people who are actually doing the construction to get the projects cured in a way that it's what we call the package. It comes in a package. You know, we're doing this for Appalachian, we're doing this for Chapel Hill, we're doing this for Pembroke, whatever the case may be. And it really, community colleges, it really took them that long to get the package to us that we could send off to bond council and get it approved. I mean, and get it to the street, so to speak. And then last year we did another $400 million of the Connect NC bonds, if my memory's right, Travis. And as soon as they got the package to us, we started meeting with the rating agencies, we started meeting with the underwriters, we started meeting with the bond council. And, you know, we're not messing around with the timing of this at all. When the voters tell me to do something, or the General Assembly tells me to do something, we do it absolutely as expeditiously as possible.
All right, I appreciate it.
Absolutely. Absolutely. Anybody else have any additional questions for the treasurer?
How about Jeff from the County Compass? Did Jeff ask anything?
Dale, I just want to thank you for that. I just want to say I don't want you to get burned out on this. I know it's an incredibly tough job. I think the rank and file in the state are behind you, but they don't understand the problem. I would love to run anything. We're a weekly. Anything that you and Frank want to get out on a regular basis, you can hit my paper, my 20,000 readers anytime. And hopefully we'll educate the public.
Well, thank you. We have a system of getting these guest editorials out that we'd be glad for for anybody to print these. I appreciate that compliment. I want to say that, as I've said before, these issues, whether it's the pension plan, let's take the pension plan for a moment. Now we're on our 21st year of the pension plan not earning its assumed rate of return on average. Last year, the pension plan paid out $6 billion in benefits, gross. We're paying out $520 million. We paid that out 2 days ago for 1 month, 30 days, 1 month. We had negative earnings last year. So the accrued unfunded liability of just the pension plan went up by over $2 billion just in 2018. I've said it to many of you in the past. These are the issues that are going to make the generational difference in the future of our state. And they're not emotional and they're not political. They're mathematical. If you start this rhetorical sentence, who ate my, ATE, who ate my public school construction money? Who ate my pay raise? Who ate my cost of living adjustment? Who ate the road project that we were going to do? The answer to that question lies in the Treasurer's office because of the massive amount of money that has to be spent every year in the pension, the health care, and interest on the debt. Last week in the Retirement System Board meeting, we just approved the employer, and I know some of you may not be with us at this point in the call, but I really would love for you to get this point. The employer contribution rate. This is not a 401k match. This is the bill that I send to DOT, to Secretary Trogdon, for every employee he has, is going to be 13% of payroll this year just for the pension. 13% of payroll just for the pension. Not for cement, not for asphalt, not for DOT trucks, not for rest areas. 13% of his budget, of his payroll is going just to fund the pension plan. That 13% has the likely potential of going to 16 to 17% over the next few years. Every percentage point is nearly $125 million cumulatively of recurring money. So just a few years from now, just for the pension plan, we're going to be asking state agencies for another $500 million just for the pension. Number two, on the health plan. The health plan is even a bigger burden than the pension. Number three, because we have some folks in here from local communities like Ginger and others, we just set the contribution rate for the cities and the counties. The city and county contribution rate is going to be over 8% this year. It's going up to double digits over the next few years. Cities and counties, because we manage their pension plan also, are facing this same issue. And cities and counties generally only have one place to go in order to pay this bill, and that is to the property taxpayers of their communities. So when you answer the rhetorical question about what ate my pay raise, what ate my cost of living adjustment, you only have to look to the Treasurer's office and look what's happening with interest on the debt, increased debt associated with Connect NC, Build NC, and now what's being proposed on the education bonds, and the annual payment that has to come into this building just to fund the retirement system and the health care.
Thank you, Treasurer. Any more questions anybody have today? Treasurer, would you like to make some concluding remarks?
We've had a very lot of people sign on the call today, and I want to thank staff for doing all this. I want to take an opportunity to brag about some things we're doing in the State and Local Government Commission. I talked earlier about access to health care and good school buildings, but let me elaborate on water and sewer. We have water and sewer districts in this state, mainly in rural North Carolina, that are financially unsustainable. That all comes under the purview of the Local Government Commission because all these water and sewer districts have issued debt somewhere along the way. My reason for saying that is that we're working with Representative McGrady and people in the Senate. We're trying to figure out how to get these water and sewer districts to work together. We cannot have people facing water and sewer bills of $150 a month. That is not affordable, therefore it won't be accessible to people. So we are working and doing everything we can to work with these people. We're not forcing them to. We're trying to create something so that people have an interest in working together to take advantage of each other's infrastructure, so everybody doesn't have to buy a new pump or a new tank or all these other things that go into the delivery of water and sewer. We think that this is a very strong message that we're sending, and we're working on a pilot project right now in Robeson County between Fair Plains and Fairmont and Fair Bluff. There's a lot of words there. To try to get folks to work together. This is a very serious issue going forward.